The FDA is considering a first, an over-the-counter birth control option to help people who don't have easy access to a doctor. Our Angeline McCall spoke with a professor who studies access to reproductive medical care, who says this is long overdue.
First heard that the FDA is considering the first over-the-counter birth control option.
Finally, like literally my reaction was, it's about time.
Amanda Stevenson is an associate professor at CU Boulder. Her work revolves around reproductive health.
Tell me a little bit about, the positives that you see in this, and then if there are any negatives as well.
First pro is that a substantial number of Americans have trouble accessing the method of contraception that they would prefer to be using. Anyone who's been sick in the last 3 years knows that getting an appointment is challenging. And so if your life is hard already, so if you're low income, if you work multiple jobs, if you're, just have trouble accessing the healthcare system because of other barriers, race, ethnicity, language, and so forth, then not having to go to a doctor removes a huge step in the process of getting oral contraception.
Besides the positives that you see, what are some of the negatives that you see?
Honestly, I don't see negatives. So we know this is a safe drug. My primary concern is whether it's covered by insurance. So in the United States, health insurance doesn't cover over-the-counter drugs like Tylenol, Band-Aids, things like that. And so there are strategies by which this may be able to be covered by health insurance. And if those are not implemented, then this won't actually improve access for most people because they would have to pay out of pocket.
Stevenson hopes the FDA approves what will be a first of its kind and something that's already available in other countries.
People are experts in their own lives, and when they get to choose when to have children, then their lives are better.
Some critics oppose this over-the-counter option because they fear people won't read the directions or label correctly or take it with a condition that they're not supposed to.
Just think of all the things we take for granted by going to the store and getting something over the counter. Any idea from research of would this prevent people from coming to Colorado for reproductive health care that they have to come to Colorado for because they can't get it in their state?
Yeah, well, Marshall, we know that people are coming to Colorado specifically for abortions when they can't receive that kind of care in other states. Now, Amanda Stevenson told me that she thinks that it could affect a small number of people who are currently coming into Colorado. But because we know that people who are receiving abortions are also people, for instance, who are on contraception, but it fails, that it may not have the biggest impact that you might expect.
Well, we'll see what the FDA decides. Thanks, Angeline.